Toy, thank you, sir. Well, when it comes to our health, we know it's much more than what we may be able to see or feel on the surface. For more complex situations, specialists are sometimes called in to help. And Dr. Ross Hewlett is an interventional radiologist with Grandview Medical, and he joins us this morning to talk about that, plus something that will interest probably a lot of women, and we're talking about fibroid tumors as well. All right, good morning. Good to see you.
Good morning.
So you went to Hoover.
Yes, ma'am.
And moved away for a while, and you're back home now, and
just got back here. Excited to be at Grandview, and it's been great so far.
Well, welcome back home. Tell us what an interventional radiologist does. What exactly do you do?
So interventional radiologists are, first and foremost, we're radiologists. So radiologists review x-rays, CTs, MRIs, ultrasounds, those kinds of things, and create reports that tell the referring physicians and patients what is going on with those images. Interventional radiologists have additional training to use those technologies, X-ray, CT, and ultrasound, to kind of look inside the body and guide minimally invasive treatments for many, many different types of pathology.
Because otherwise, I would assume in the past, maybe a long time ago, you would have to open somebody up to see something that was going on, and that made it even more difficult of a situation.
Absolutely.
And so with what you're able to do, you talk about the minimally invasive. Give me some examples of what you can do now that's different, perhaps.
So we treat all kinds of different things. We do very simple things like biopsies of lumps and bumps. We can put in drains for infections and abscesses, help drain those, and provide treatment without a surgical procedure to drain those. We can provide tumor treatment, so we can put in a special needle that goes into the tumor, and I can burn or freeze the tumor without an incision to get there.
That makes the recovery so different.
Much quicker, quite often done as an outpatient.
All right, I understand that this is July is actually Uterine Fibroid Awareness Month. And I would imagine that's important because, you know, a lot of women don't have those, so you may not be aware of what they are, but a lot of women who do maybe not have found out until you did like a test, I guess, to see they were having a problem before that.
So a lot of women find out through an ultrasound that they have fibroids. A lot of times it's, you know, heavy menstrual bleeding or cramps or bulk symptoms. And so we are able to go in to treat those through the blood vessels. So we can go in, use the blood vessels as kind of a highway to get there, take the off-ramp to the vessel that treats the uterus, and we can block off that blood vessel, and that leaves the uterus healthy, but shrinks the fibroids, and it does a really great job of treating the fibroids.
So that's really changed everything for women who still want to have children down the road. Was it before? Would it become an issue and maybe put that at jeopardy years ago? So
both surgical options and embolization have some risks that come with future pregnancies. Both surgical options and embolization have come a long ways in allowing women to become pregnant in the future. So
talk about the results. What kind of results do you get with this kind of procedure?
So we get fantastic results. What we judge our results off of are based on the symptoms. The most common symptom that brings patients to see me is heavy menstrual bleeding. We can also see bulk symptoms like constipation or frequent urination. We get about 95% success rate at relieving those symptoms with our treatments.
But I'm assuming not everyone gets these treatments?
So not everyone knows that these are options to treat. You know, it's a little bit of a newer procedure, and not everyone realizes that this is available.
So what should you do? I guess talk to your physician and ask them about something like this. What should they ask?
So absolutely. So they can ask for minimally invasive options to treat these tumors, and they can ask specifically about uterine artery embolization for fibroids. You know, they can ask their doctor to send a referral to Grandview Radiology, Birmingham Radiological Group, and we can kind of take it from there and evaluate them and see if they're candidates for a treatment.
How prevalent is it? How many do you see, you think?
You know, it is a very prevalent disease, especially in African Americans, and it's an under-recognized disease because it kind of gets brushed off. The symptoms are easy to kind of pass off as just really bad, severe menstrual symptoms.
So with it it's not non-cancerous. So with it being non-cancerous, people may think, well, what's the big deal? But what happens if it's not treated?
So if left untreated, the heavy menstrual bleeding can cause problems with anemia. A lot of these women are taking iron supplementation to try and maintain blood counts. That can lead to constipation. Not to mention, it can be a really uncomfortable process, severe cramps. Nobody enjoys the frequent urination or constipation that can come along with these large tumors.
Is it found right away, or is it, can it take a minute to figure out what's going on?
It can take a little bit to diagnose. Most commonly it's diagnosed when these women see their OBGYNs, and they'll get a pelvic ultrasound to evaluate the uterus.
Okay, so I guess to wrap up, the lesson is, don't assume it's just normal, that you may just have a heavy period. There could be something else going on that could be fixed.
Absolutely.
All right. He is Dr. Hewlett. Good to see you, sir.
Thank you. I appreciate the opportunity.
Now here's Jay.